Welcome to this special edition of ID Rounds. I'm Dr. Ganoni, and today we're looking at the next frontier of HIV management. Over 3 decades, antiretroviral therapy has transformed HIV from a fatal infection into a manageable chronic disease. But we are now entering a transformative period. Modern regimens achieve virologic suppression in over 90% of treated individuals, giving patients a life expectancy comparable to the general population. Despite these advances, daily oral therapy remains a challenge. Pill fatigue, polypharmacy, and the persistent stigma of daily medication are real barriers. Research and development have shifted. We're now prioritizing patient-centered outcomes, moving toward less frequent dosing to improve quality of life. The goal is functional cure or remission. We're targeting HIV reservoirs with novel classes like nucleoside reverse transcriptase translocation inhibitors. A key advancement is islatravir. As a first-in-class NRTTI, it inhibits replication through multiple mechanisms, including translocation blockade. This produces immediate chain termination and induces structural changes in viral DNA, resulting in delayed chain termination and blocking the virus. Progress hasn't been without hurdles. In 2021, higher doses of islatravir were found to cause dose-dependent lymphopenia, leading to a temporary clinical hold. Manufacturers have since shifted to lower doses. Trials evaluating daily 0.75 mg doses noted a need for further reductions to maintain safety. The current focus is on a 0.25 mg dose. This lower dose has demonstrated significantly improved hematologic safety in clinical trials. This enables once-weekly oral formulations, a major shift from daily adherence requirements that addresses a critical barrier for many patients. The ISLAND trials evaluated the combination of lenacapavir and islatravir, maintaining a 94.2% viral suppression rate at 48 weeks. While some adverse events like respiratory infections were reported, none of the serious events were attributed to the study drug by investigators. Beyond islatravir, the most recent innovation is the capsid inhibitor class, pioneered by lenacapavir, which targets multiple stages of the viral life cycle. Unlike traditional antiretrovirals, these interfere with capsid assembly, nuclear import, and even virion maturation, providing a broad defense. The Artistry trials are investigating daily combinations of lenacapavir and bictegravir, showing statistical non-inferiority to complex regimens. A single-tablet regimen of this type may further transform treatment, offering sustained suppression with a next-generation antiretroviral strategy. The pipeline is deep, with novel agents like GS4182, a weekly oral prodrug, and combinations being tested in the WONDERS trials. Some trials, like those for GS1720, are currently on hold due to safety signals, but the industry remains committed to pursuing these agents at safer doses. While we improve adherence, the latent HIV reservoir remains the key area of research for achieving long-term remission or a potential cure. Broadly neutralizing antibodies, or BNABs, bind conserved epitopes on the viral envelope, enabling the immune system to clear infected cells. BNABs offer significant advantages: long half-lives, no drug interactions, and minimal toxicity compared to traditional oral therapies. Agents like teropavimab and zinlervimab are being combined with lenacapavir, seeking a complete 6-month injectable regimen. Early pilot studies are promising, no serious side effects occurred, and 80% of participants maintained suppression for 26 weeks. This multi-mechanistic approach suggests that an HIV cure will likely require a combination of immunologic and powerful antiviral therapy. Investigational agents like fasadalimod aim to activate the innate immunity, essentially flushing out latent HIV reservoirs for immune clearance. We're also seeing bispecific T-cell engagers like GS8588, which simultaneously bind infected cells and cytotoxic T-cells to enable destruction. Prevention is pushing boundaries too. We're moving from daily PrEP to ultra-long-acting options that could transform public health. The Purpose 365 trial is evaluating a yearly dose of lenacapavir for PrEP, administered intramuscularly. 1 dose for an entire year. We're also testing cabotegravir every 4 months, and monthly oral options like MK8527, positioning long-acting ART as the cornerstone of prevention. The ART pipeline represents a transition from chronic suppression to durable remission, and, potentially, an eventual cure. In the near future, HIV management may no longer rely on daily pills, but on therapies received just a few times per year. While challenges in cost and implementation remain, this is one of the most transformative periods in HIV pharmacotherapy. Thank you for joining me for this ID round. The next milestone in HIV medicine is not just better treatment, it's long-term viral control. I'm Dr. Ganoni.